June 7th, 2023. 4:12 a.m. Houston, Texas. The parking lot of a Denny's off Interstate 45 near Conroe is empty except for a convoy of unmarked vehicles arranged in 2 disciplined rows. Inside, more than 200 federal agents sit in silence, engines off, dome lights extinguished, body cameras powered on, raid jackets folded on laps, the yellow letters FBI and DIA and HASOIG waiting to be displayed. At 4:30 a.m., a secure radio channel transmits a single word: execute. Doors open across 12 jurisdictions simultaneously: Galveston, Beaumont, San Antonio, Lubbock, Dallas, McAllen, Amarillo, Midland, El Paso, and 3 locations within the Houston metropolitan area itself. Agents pour out of vehicles and approach nondescript commercial buildings, strip mall offices, converted residential properties, standalone medical suites with faded signage and barred windows. These are pain management clinics. At least, that is what their state licenses say. What they actually are, what 2 years of federal investigation have determined them to be, is something far more dangerous. They are pill mills. Assembly lines of addiction. Distribution hubs for a pharmaceutical poison that has killed more Americans in the last decade than every war fought since Vietnam combined. And the people who run them wear white coats and stethoscopes. The investigation that culminated in this pre-dawn takedown began in the fall of 2021 with a data anomaly that should have been impossible to ignore. Analysts at the Drug Enforcement Administration's Diversion Control Division were conducting a routine review of the Automated Reports and Consolidated Ordering System, known as ARCOS, the federal database that tracks every controlled substance manufactured, distributed, and dispensed in the United States. The analysts flagged a cluster of prescribers in Texas whose opioid dispensing patterns deviated so dramatically from statistical norms that the data initially appeared to be a system error. It was not an error. 12 pain management clinics, spread across the state but connected through overlapping ownership structures, corporate shell entities, and shared billing infrastructure, were collectively responsible for prescribing and dispensing opioid medications at volumes that defied medical explanation. One clinic in Beaumont, operating with a single prescribing physician and 2 medical assistants in a facility smaller than a typical 2-bedroom apartment, had dispensed 347,000 dosage units of oxycodone in a single fiscal year. A clinic in McAllen, located in a converted auto parts store with the original signage still partially visible beneath a vinyl banner reading Lone Star Pain Relief, dispensed 290,000 units of hydrocodone over the same period. For context, a typical pain management practice with a full patient panel prescribes between 15,000 and 30,000 opioid dosage units annually. These clinics were operating at 10 to 20 times that volume. And they were doing it in communities already devastated by the opioid crisis. The DIA referred its findings to the FBI's Public Corruption and Healthcare Fraud units in the southern and western districts of Texas. A joint task force was assembled. Wiretaps were authorized. Undercover agents were deployed. Confidential informants were cultivated from within the clinics themselves. What emerged over the next 20 months was a portrait of institutional corruption so thorough, so deliberately constructed, that it operated less like a medical practice and more like a narcotics trafficking organization with a pharmaceutical license. The scheme began with the patients, or rather, with the recruitment of individuals who would serve the function of patients within a system designed to generate prescriptions, not provide care. Recruiters, referred to internally as runners and intercepted communications, operated in communities across Texas targeting populations with specific characteristics. Individuals with chronic pain diagnoses already documented in their medical histories. Individuals covered by Medicare, Medicaid, or commercial insurance plans that reimburse generously for pain management services. Individuals struggling with existing opioid dependence who would reliably return for refills. And, most critically, individuals who would not question the volume or nature of medications prescribed to them. The runners were paid per head, $50 for each new patient delivered to a clinic. An additional $25 for each return visit. Some runners operated social media accounts advertising same-day pain relief and no-wait prescriptions. Others recruited directly from homeless shelters, halfway houses, and the waiting areas of methadone maintenance programs, targeting people in the grip of addiction and offering them the very substance destroying their lives. Once a recruited individual arrived at a clinic, The encounter followed a rigid, mechanized protocol that bore no resemblance to legitimate medical practice. Vital signs were taken by unlicensed staff. A brief questionnaire was administered, the same questionnaire for every patient, regardless of presenting complaint, medical history, or prior treatment. The patient was then seen by a physician for an encounter lasting, according to undercover agents who documented the process firsthand, between 90 seconds and 4 minutes. 90 seconds. To evaluate a patient presenting with chronic pain. To assess risk factors for addiction. To determine appropriate pharmacological intervention. To fulfill the legal and ethical obligations of a medical license granted by the state of Texas. In 90 seconds, the physician wrote a prescription. Oxycodone 30 milligrams, quantity 120, or hydrocodone 10-3325, quantity 180, or, in some cases, a combination of opioids, benzodiazepines, and muscle relaxants, known on the street as the Holy Trinity, a cocktail so pharmacologically dangerous that its combined respiratory depressant effects have been directly linked to thousands of overdose deaths nationwide. The prescriptions were filled on-site. Many of these clinics operated their own dispensaries, a practice that eliminated the oversight function of independent pharmacies and allowed the operation to capture both the prescribing revenue and the dispensing revenue from each patient encounter. The profit margin on a single visit, combining the office visit billing, the dispensing fees, and the markup on medications purchased wholesale, ranged from $800 to $1,400 per patient. Multiply that by the patient volumes these clinics maintained. Some were processing 80 to 100 patients per day. Per day. 6 days a week. The mathematics of the operation were staggering, and they were, by design, invisible to the patients cycling through the system. At the center of the network stood a figure whose public identity could not have been more carefully curated to contradict his criminal reality. Federal indictments identify the alleged ringleader as a licensed physician and businessman who owned or held controlling financial interest in 9 of the 12 clinics through a web of limited liability companies registered across Texas, Nevada, and Delaware. He maintained a visible community presence. He sponsored youth baseball leagues in 2 Houston suburbs. He attended fundraising galas for hospital foundations. He served on the advisory board of a regional health policy institute. His social media profiles featured photographs of him in surgical scrubs at medical conferences, shaking hands with state legislators at healthcare roundtables, standing beside his family at charity events. The portrait of a dedicated physician. A pillar of the community. A healer. Wiretap transcripts tell a different story. In one intercepted call from March 2023, the defendant discussed strategies for increasing patient throughput at the Lubbock Clinic with a co-conspirator who served as regional operations manager. "We need 80 a day minimum out of Lubbock," he said. "If the doctor can't move 80, replace the doctor." In another call, recorded in April 2023, he instructed a clinic manager to deny a refund request from a patient who complained about the brevity of the medical encounter. "They're not paying for time," he said. "They're paying for the script. They know that. We know that. Move on." The language of commerce. The logic of product distribution, applied to Schedule II controlled substances with the highest addiction potential in the federal classification system. The drugs dispensed through these clinics did not remain in the hands of the patients who received them. Federal investigators, working with state and local law enforcement, traced the downstream distribution of prescribed medications through surveillance, controlled purchases, and cooperating witness testimony. A significant percentage of prescriptions, investigators estimate between 30 and 45%, were diverted immediately upon dispensing. Patients sold their medications in parking lots outside the clinics. Runners purchased pills back from patients at a fraction of street value and resold them through secondary distribution networks operating in Dallas, Houston, San Antonio, and across the Louisiana border. The street price for a single oxycodone 30 milligram tablet in Texas during the period of the conspiracy ranged from $25 to $40. A single prescription of 120 tablets, obtained through a clinic visit costing the patient approximately $250 in cash, represented a street value of $3,000 to $4,800. The economics of diversion incentivized every participant in the chain. Patients profited. Runners profited. Street-level distributors profited. And the clinics, having already collected their fees and billed insurance where applicable, bore no financial risk from the diversion they had deliberately facilitated. Meanwhile, the pills entered communities already hemorrhaging from the opioid epidemic. They entered the hands of teenagers who purchased them from classmates. They entered the bloodstreams of construction workers self-medicating injuries without insurance. They entered the veins of individuals who crushed and injected them when oral ingestion no longer delivered sufficient effect, and they entered the bodies of people who did not survive the encounter. The indictment links prescriptions originating from the 12 clinics to at least 19 confirmed overdose deaths across Texas and Louisiana between January 2022 and May 2023. 19 individuals whose final interaction with the healthcare system was a 90-second appointment in a converted storefront, followed by a bottle of pills that killed them. The raids on June 7, 2023, were executed with the precision of a military operation and the bureaucratic thoroughness of a federal investigation 2 years in the making. At each of the 12 locations, agents secured the premises, detained on-site personnel, and initiated systematic evidence collection. The inventory from those raids reads like the ledger of a pharmaceutical warehouse crossed with a money laundering manual. Across all 12 locations, agents seized a combined 2.04 million opioid dosage units, oxycodone, hydrocodone, morphine sulfate, and fentanyl patches. They seized 146 boxes of patient files, many containing fabricated medical records with identical clinical notes copied verbatim across hundreds of charts. They seized 37 desktop computers and 14 servers containing billing records, scheduling databases, and internal communications. They seized $3.8 million in cash from clinic safes and associated residences. They seized 9 luxury vehicles. They froze 23 bank accounts containing a combined $14.6 million. At the primary residence of the alleged ringleader in the Woodlands, a gated community north of Houston, agents executed a separate search warrant. Inside the 6,200-square-foot home, they documented $890,000 in cash concealed in a floor safe beneath the master bedroom closet. Title documents for a vacation property in Cabo San Lucas, a collection of 17 luxury watches with an estimated combined value exceeding $400,000. And a loaded handgun in a nightstand drawer, a detail noted in the affidavit as indicative of a defendant who understood the criminal nature of his enterprise and the dangers that accompanied it. The indictments, unsealed the same day, charged 40 defendants in total, 40 individuals who participated in a conspiracy to distribute controlled substances outside the bounds of legitimate medical practice, to defraud federal healthcare programs, to launder the proceeds of that fraud, and, in the case of 8 defendants including the alleged ringleader, 2. Distribute controlled substances resulting in death. That final charge carries a mandatory minimum sentence of 20 years in federal prison. A maximum of life. At the press conference held at the U.S. Attorney's Office in Houston that afternoon, the United States Attorney for the Southern District of Texas addressed a room packed with reporters, cameras, and law enforcement officials from 9 agencies. What we dismantled today was not a medical practice. It was a drug trafficking organization that hid behind the legitimacy of medical licensing to poison communities across this state. These defendants did not treat pain. They manufactured addiction. They manufactured dependence. And in at least 19 documented cases, they manufactured death. The DIA's special agent in charge for the Houston division added a statement that carried the weight of institutional exhaustion with a crisis that has now killed more than 500,000 Americans. We will continue to pursue every physician, every clinic operator, every recruiter, and every enabler who turns the practice of medicine into a vehicle for drug distribution. The white coat does not grant immunity. The medical license does not provide cover. Not anymore. In the year following the raids, the judicial machinery advanced. 31 of the 40 defendants entered guilty pleas. 7 proceeded to trial. 2 remained fugitives as of the most recent public filings, believed to have fled to Mexico. Sentences for those who pleaded guilty ranged from 48 months to 240 months in federal prison. The alleged ringleader, convicted at trial on all counts including distribution resulting in death, received a sentence of 35 years. He was 52 years old at sentencing. He will be eligible for release under federal guidelines at the age of 82. Victim impact statements submitted to the court filled 340 pages. A mother from Beaumont described finding her 23-year-old son dead on the floor of his apartment, a prescription bottle from one of the raided clinics on the table beside him, still bearing the label with the prescribing physician's name. He went to that clinic because he trusted the doctor, she said. He trusted the white coat. He trusted the system. And the system killed him. A paramedic from San Antonio submitted a written statement describing responding to 4 overdose calls in a single shift, 3 of which involved medications traced to the clinic network. "We are drowning out here," he wrote. "And these people were holding our heads underwater. 2 million pills seized. 40 doctors and operators indicted. 19 confirmed dead. And the fundamental question remains unanswered, not by this prosecution, not by any prosecution." The opioid crisis did not begin in a strip mall clinic in Beaumont, Texas. It began in boardrooms and regulatory offices and medical schools and pharmaceutical laboratories where decisions were made, incentives were structured, and oversight was systematically weakened to prioritize profit over human survival. The 40 defendants in this case exploited a system that was already broken. They walked through doors that were already open. Every year, approximately 80,000 Americans die from opioid-related overdoses. Every year, new pill mills open in new strip malls in new cities, staffed by new physicians willing to trade their oath for revenue. Every year, the cycle continues. Operation Lone Star Takedown removed 40 participants from that cycle. It recovered millions in cash and seized millions of pills. It delivered accountability to 19 families who deserved answers. But 2 million pills were seized on June 7th, 2023. On June 8, somewhere in America, a clinic opened its doors. A physician picked up a prescription pad, and a patient walked in looking for relief from pain that the system itself had created. That clinic is still open. That physician is still prescribing. That patient is still waiting. And the clock is still running.